My name is Michelle Crain, and this is my audience. All women are at risk for breast cancer. The risk of getting breast cancer increases as you age. Most breast cancer deaths occur in women age 50 and older. Although rare, younger women can also get breast cancer. Fewer than 5% of breast cancer occurs in women under 40. However, breast cancer is the leading cause of cancer death among women ages 20 to 59. Men can also get breast cancer. Although rare, it does happen. In the U.S., about 1% of all breast cancer cases occur in men. Today, I would like to discuss with you what screening and early detection mean, and later I will discuss with you the importance of screening in women who are at high and average risk, as well as screening in men. I want to start off by defining screening and early detection, and then I will tell you the types of screening which are available. The goal of screening tests for breast cancer is to find it before it causes symptoms or a lump can be felt. By the time a lump can be felt, it has likely been growing for up to 10 years. Screening refers to tests and exams used to find a disease in people who don't have any symptoms yet. Breast cancer found during screening exams are more likely to be smaller and still confined to the breast. Early detection means finding and diagnosing a disease earlier than if might have happened if you'd waited until symptoms appeared. More doctors feel that early detection tests for breast cancer help save thousands of lives each year, and many more lives could be saved if even more women and their healthcare providers took advantage of these tests. The most common forms of screening are clinical breast exams, mammography, and breast MRI. Now that we know about breast cancer screenings and what they are, let's discuss screening in women who are high risk. Routine breast cancer screening is important for all women, but even more so for those who are at higher risk. If you are a high risk for breast cancer, you may need to be screened earlier and more often than women who are at average risk. The three major factors that greatly increase breast cancer include a BRCA1 or a BRCA2 gene mutation or a first-degree relative with this mutation, a strong family history of breast cancer, such as a mother or sister who has been diagnosed at age 45 or younger, or a personal history of invasive breast cancer or ductal carcinoma in situ. The American Cancer Society and the National Comprehensive Cancer Network recommend women who are at high risk should have regular breast exams every year under the age of 25 and every 6 to 12 months ages 25 and up if you have a gene mutation. A mammogram and breast MRI are usually recommended every year ages 25 and up. If you have a strong family history of breast cancer, clinical exams are recommended every 6 to 12 months ages 30 and older, and these women should have a mammogram and breast MRI every year. Now that we have discussed screening at high risk women, let's move on to average risk. Mammography is the most effective breast cancer screening tool used today. Mammography in women ages 40 to 49 may save lives, but the benefit is less than for older women. Findings from the U.S. Prevention Services Task Force meta-analysis showed that women ages 39 to 49 who got mammograms on a regular basis had a 15% lower risk of dying from breast cancer than their peers who did not get mammograms. For women ages 50 to 69, the life-saving benefits of mammography are clear. These women should have mammograms on a regular basis. Findings from the U.S. Prevention Services Task Force meta-analysis showed that women ages 50 to 69 who got mammograms on a regular basis had a 14 to 32% lower risk of dying from breast cancer than their peers who did not get mammograms. The task force recommends mammography every 2 years for women 50 to 69. The American Cancer Society recommends mammography every 2 years for women ages 55 and older. Now that we have discussed screening in women, let's move on to men. Breast cancer in men is rare, but it does happen. About 1% of all breast cancer cases in the U.S. are diagnosed in men. Men have much less breast tissue compared to women and are not routinely screened for breast cancer. Breast cancer screening is only recommended for some men at higher risk due to an inherited gene mutation or a strong family history of breast cancer. For those men, screening may increase the chances that breast cancer is found early, when the chances for survival are highest. The National Comprehensive Cancer Network recommends that men at high risk for breast cancer should have a clinical breast exam every 6 to 12 months starting at age 35 and should consider having a mammogram at age 40, and depending on the findings from the first mammogram and the amount of breast tissue, yearly mammograms be recommended. Now that we have discussed screening in both men and women, I would like to conclude with a couple of estimates from the Susan G. Komen Foundation. In 2015, it was estimated that among U.S. women, there would be 231,840 new cases of invasive breast cancer, 620,290 new cases of in situ breast cancer, and 40,290 breast cancer deaths. In men, it was estimated that there would be 2,350 new cases of breast cancer and 440 breast cancer deaths. According to many breast cancer research foundations, many of these deaths could have been prevented if only the patients had routine screening or early detection exams. If you are a high-risk woman or man, I urge you to consider routine screening for breast cancer. You can get more information from your healthcare provider. And this is my audience.